I am Dr. Suresh Babu, Senior Consultant Neurologist and Epileptologist at Arete Hospital. As we commonly see a big seizure or the roadside, which is a very dramatic event and which catches the attention of the everyone, I thought the discussing about this one will help the people to understand what is GTCS and what to do when somebody has a GTCS. GTCS full form is Generalized Tonic-Clonic Seizures. So as the name suggests, it goes through a sequential phases. Imagine that person is sitting in a chair. That GTCS starts, first eyes becomes widely open and they will remain open till the end of the active seizure, and their mouth also will be open during that time. This will be there for few seconds. So you are seeing a person, suddenly they become like a silent with eyes open and mouth open, and they will not be responding. Within few seconds it convert into, suddenly their neck will go into the backwards, their hands will be outstretched and their elbow will be little flexed, and with this position he will be there for 10 to 20 seconds. As the muscles are in this position, legs also almost assume the same position, but mostly hands will assume this position. After the few seconds, hands will lower down and they will come to this position, they will cross in front of the chest, and this will be there for few seconds. As you know, when the hands are tight, his chest muscles and abdominal muscles also become tight. When they become tight, the air comes out of the vocal cords, which creates that shrill cry what you will hear during the GTCS. At the same time, mouth also will be closed during this phase. So sometimes there can be a tongue bite during this phase, and this lasts for the few seconds. After the few seconds, you see that this outstretched hands, there will be a little vibratory movements. This will last for the few seconds. After this, the person entered into the clonic phase. When during this clonic phase, both hands and legs will be in an extended position. They have a synchronous and simultaneous contractions like this. During this time, all muscles from the head to toe will have this clonic jerking, the repetitive jerking. That jerking from the facial muscles to the hand, trunk and the legs, and because of the repetitive jerking of the hand, they can have a multiple tongue bites, and because of the repetitive contraction of the chest and the abdominal muscles, they can have this shrill cry coming repeatedly. And during this time, because of phase lasts for the 10 to 20 seconds, and then they will go into the very hypotonic stage where they take the deep inspiration, and at the time you will see the froth coming from the mouth, which can be a blood tinged because of the tongue bite. And afterwards, next few seconds, they will recover and they have a little muscle pains and the fatigue. And this is how the GTCS will go in a phase wise manner. So if you see the phases, initially they will be little silent period where eyes and mouth will be open, and then you can see a neck extension and the outward extension of the both hands and the extension of the legs, and then followed by the tonic position of the both hands and legs. It is like a more like a silent phase where all the muscles are in a tonic phase, and then you see a jerking of from the facial muscles to the upper limbs, lower limbs and the trunk muscle.